Hello everyone, today we are going to learn gallbladder meridian of foot Shaoyang acupoint. The acupoint of gallbladder meridian of foot Shaoyang originated from Tongziliao, which is located on the head and face. 足鞘阴 and at the end of the toe. This meridian has 44 acupuncture points. This picture shows the gallbladder meridian of foot Shaoyang on the acupoint of the head. On the head, the acupoint of the gallbladder meridian of the foot Shaoyang are very dense. This is closely related to the complicated meridian circulation line of the lateral head of the gallbladder meridian of the foot Shaoyang. Starting acupoint, 童子髎, located outside the outer corner of the eye. Acupuncture in front of the ear. 听会, 上关, acupoint on the edge of the airline. 汗焰, 悬颅, 悬离, 曲鬓. Behind the ear, in the airline. 率骨, 天冲, 浮白, 头翘阴, 板骨, 本身, 阳白, 头灵气, 目疮, 正营, 成灵, 脑空, 风池. Acupuncture point on shoulder. 肩颈, acupuncture point on the ribs. 渊叶, 折筋, 日月, southwest abdomen, 经门, 带脉, 五腧, 为道, 居髎. Outer thigh. 环跳, 风市, 中堵, 西阳关. Acupuncture point in calf. 阳交, 外丘, 光明, 阳府, 悬中. Acupuncture point on the foot. 丘虚, 足灵气, 第五会, 狭溪, 足翘阴. Gallbladder meridian of foot Shaoyang has 44 acupuncture points. The number of points of the gallbladder meridian of foot Shaoyang is inferior to that of bladder meridian of foot Taiyang and stomach meridian of foot Yangming, which is the third meridian. First of all, we study the point of Yanglingquan. Yanglingquan is a very important acupuncture point on the lower leg of the gallbladder meridian of the foot Shaoyang, which is located on the outer side of the lower leg and in the depression anterior and interior to the head of the fibula. In order to grasp this acupoint, we must grasp the following automatical signs. The first is fibular head. Before finding the fibular head, we understand the bone distribution in the calf. In anatomy, we have learned that the calf bones include the lateral fibula and the internal tibial. The fibular head is a bony protrusion of the upper end of the fibula, which is located outside the knee joint. Please see this picture, which shows that there is a bony protrusion on the outside of the knee joint, which is the head of the fibula. In order to find the Yanglingquan in the depression below the anterior fibular head, we have to find another bony protrusion. This bony protrusion is called the lateral tibial condyle and is located outside the knee joint. Because the tibial is the inner bone of the lower leg, compared with the fibular head, the lateral condyle of the tibial is located in front of the above the fibular head. In order to find Yanglingquan, make a straight line between the fibular head and the lateral condyle of the tibial. The distance between them is one side of the equilateral triangle. Make an equilateral triangle forward and downward. The vertex of this equilateral triangle is Yanglingquan. We already know that yang Quan is in the depression anterior and interior to the head of the fibula. This is a lot of muscle here. In clinical operations, it's often used to press the needle 1 to 1.5 ton straight. The specific depth of needle insertion is clearly related to the patient's sense of anger. Yang Quan is not only the meridian of the gallbladder meridian of foot Shaoyang, it is also a very important specific acupoint. Next, we will study the specific categories in Yang Quan. First of all, Yang Quan is He acupoints in the 5 shu acupoints of the gallbladder meridian of foot Shaoyang. We have learned in the specific point theory of acupoints. He acupoint is an important injection point in the deep part of the meridian. Therefore, Yang Quan, as the He acupoint of the gallbladder meridian of the foot Shaoyang, the meridian qi deepens here. In addition, Yang Quan is the lower He acupoint part of the body. Lower He acupoint refers to 6 acupoints located on the 3 yang meridians of the foot where qi from the 6 Fu organs converge. Lower He acupoint is connected with the qi of the 6 Fu organs. So, Yang Quan acupoint is the lower He acupoint of the biofu organs, which is directly connected with the qi of the biofu organs and has a very close relationship with the biofu organs. In addition, Yang Quan is one of 8 confluent acupoints associating with tendons. According to the records in Classic of Difficult Issue, the meeting place of the sinew, Yang Quan. The meeting place of the sinew refers to the area where the body's tendons, meridians, and meridians qi gather. Yang Quan is the meeting place of the sinew, so it is closely related to the body's meridians, tendons, qi, and blood. Yang Quan is very commonly used in clinic. In order to use Yang Quan correctly, we must master its efficiency and indications. First of all, Yang Quan acupoint has obvious effect of normalizing the gallbladder function to treat jaundice. Yang Quan acupoint is the lower He acupoint of the biofu organs, which is directly connected with the qi of the biofu organs. While in the 5 elements is wood, its wood gas is easy to accumulate and heat. Therefore, hepatobiliary qi is prone to stagnation and heat, and depth and heat stagnation leads to jaundice, bitter taste in the mouth. Hepatobiliary qi stagnation can also cause chest pain. Wood and soil are grammatical. When wood qi stagnate, easy to restrain the spleen and stomach, so that the spleen and stomach qi affect digestion and absorption, causing vomiting and acid reflux and other gastrointestinal symptoms. Therefore, Yang Quan has a good effect of normalizing the gallbladder function to the jaundice. This effect can not only treat jaundice, bitter taste in the mouth, hypochondriac pain, and other gallbladder disease, but also help the stomach restore its function, and can be used to treat vomiting. In addition, Yang Quan, as meeting place of this sinew, has a good effect of relieving rigidity of muscle and relieving pain. The analgesic effect of Yang Quan is mainly manifested is good at treating syndrome of lower limb and weakness, as well as lower limb pain, lower limb paralysis. In addition, Yang Quan is located near the knee joint. Therefore, it is commonly used to treat weakness and pain in the knee joint, since the joint is an important part of meridians and tendons. The shoulders of the upper limb are also meridian and tendons. Therefore, Yang Ling Quan can not only treat the pain in the knee joint, but also treat the pain in the upper limb. Next, we study the clinical application of Yang Ling Quan. Yang Ling Quan has a good effect of normalizing the gallbladder function to treat jaundice. When treating symptoms such as jaundice, bitter taste in the mouth, hypochondriac pain caused by common gallbladder disease, Yang Ling Quan often cooperates with the gallbladder meridian front move acupoints 日月 and the gallbladder meridian 北枢 acupoints 胆枢 to strengthen the effect of Yang Ling Quan on normalizing the gallbladder function to treat jaundice. At the same time, Yang Ling Quan can calm the hepatobiliary qi and treat the vomiting caused by the stomach qi ascending counterflow. When treating vomiting, Yang Ling Quan is often matched with Zhu San Li of lower He acupoints of stomach meridian and Zhongwan of stomach meridian of foot Yang Ming to strengthen its ability to calm the qi of liver and calm the stomach qi. In the treatment of limb pain, when the treatment of lower limb weakness and limb pain, knee joint swelling pain, Yang Ling Quan often cooperates with the Shaoyang Guan near the knee joint, the calf nose of the stomach meridian, and Zhu San Li to calm the local meridians and blood to treat the paralysis of the lower limbs and knee joints. In the treatment of shoulder pain, Yang Ling Quan also cooperates with Jianjing point, Jianyu point of the large intestine meridian of hand Yang Ming and Jianliao point of the three-jaw meridian of hand Shaoyang, and strengthens its effect of relaxing shoulder qi and blood. Everyone should pay attention to the specific application of Yang Ling Quan. First, take partial Jianjing, Jianyu, Jianliao acupuncture. After the needle at the shoulder acupoint, and then acupuncture Yang Ling Quan. In the Yang Ling Quan needle line, maintain a clear needle sensation. At the same time, the movement of the pain of the shoulder joint. This can play a better role in relieving pain. The above are the positioning, acupuncture occupation, attending effect, and specific clinical application of Yang Ling Quan. I hope you can master and review in time.